Every day, you and I get bombarded with negative news. And just like our bodies becomes what we eat, our minds become the information that we consume. If you want to stay positive, it's so important that you also listen to stories that inspires you and uplifts you. In this podcast, we interview world-leading experts dedicated to solving the world's most pressing problems. And if you stick around, I promise you will not only be as informed as if you watch the news, you will feel uplifted, inspired, and have more positive energy in your life. Welcome to Great.com Talks with. Hi and welcome. Today, Great.com talks with Amy Pumo, who is the Director of Clinical Services at the New York Society for the Prevention of Cruelty to Children. And if you haven't heard of them before, they have a very interesting history. They were the first child protection agency in the world, and they've been existing for over 145 years. And if you're new here into this podcast, definitely press subscribe, either on YouTube or in your podcast app, because today we will talk about how can we meet the complex needs of abused and neglected children. Amy, thank you so much for taking the time to speak with us today.
It's my pleasure.
So, how would you describe your organization to someone that is not familiar with the work that you do?
Well, I think the introduction that you gave is a good start in the sense that we are the first child protection organization that developed in the world in the late 1800s. We are a child welfare organization, and our primary mission is to support and protect children from harm. And we do this through direct services that we provide to families, as well as advocacy for legislation that protects children. And we also have a substantial training institute that works to reach both children and families and communities, as well as professionals in the field to assist them in better helping and protecting children.
To me, that it's so wonderful, the work that you do. And to me, the 145-year history is so interesting. So I'm curious, of course, about the challenges that you are facing today. But let's start at, what were the problems the founders of these organizations were trying to solve back then?
Yeah, well, it was in the late 1800s, and it was a time when there were no laws protecting children from abuse and neglect. Children weren't seen as having rights, and there were a lot of problems that were occurring in New York City based on immigration and the time period that we were facing as a country, having come out of the Civil War. And interestingly, there were laws protecting animals from cruelty, but none protecting children. And our founders actually used those laws to litigate the first case of a child removal due to severe abuse. But there was a large population of new immigrants. Children were being exploited in terms of labor, and so there was a lot of crime in Manhattan, and so it just sort of all converged to create a very unsafe time for kids in the country.
That is horrifying. And at the same time, I'm filled with some kind of gratitude that even though the problem is still big, at least we have made some way since that time. And you have actually made a lot of way. You have helped over 2 million children in 145 years. So if we go back to present time, what kind of challenges are the children facing today?
Well, certainly we have, in fact, our modern child protection laws were really sort of the foundation for those were formed at the time that we're just talking about, when our organization came into being. And so we certainly have a lot more laws protecting children. We have institutions and organizations that have developed around these needs. For example, in the late 1970s or mid-1970s is when the government started taking over the role of child protection. So we now have a very structured system for identifying children in need of assistance, as well as for intervening. So that has been significant progress, clearly, from those early days when child abuse was generally accepted and there was no course to address those issues.
Yeah. Yeah, it's so easy to take for granted where we are today, and to just think of a time where it was just natural and accepted that you would abuse your children. Now, you said you worked with educational services as a part of the solution to the problem that still exists today. How are you doing that? How does these educational programs look like?
Yeah, so our training institute, as I mentioned, focuses or targets both professionals in the fields as well as children and families and communities. We have programs that go into schools. One of the biggest areas of focus for our organization is sexual abuse prevention, and we have a curriculum for little kids, middle-aged kids, not middle-aged, but middles, we call them, the elementary school age children. And then we have a program for teens where we go into schools and talk with them. All of these, the problems as they exist today, one of the greatest obstacles is just the silence and the shame and stigma around discussing these issues. So the more knowledge and that we can bring to families and to communities, the more we can break that silence, then the more likely we are to prevent the abuse from happening. So that's one of our main goals, is alerting people, in every layer of society, to be aware of these issues and to know what to look out for, to identify the issues and what to do if you have a suspicion that that a child is being abused or neglected. So we go into schools and provide trainings to parents, children, and then we have an assortment of different trainings that we provide to professionals to assist them in that process as well. Childcare, daycare providers, teachers. We have a comprehensive child abuse and neglect reporting training for anyone in New York State who is a mandated reporter. So there's quite a lot that we do to specifically for sexual abuse, but also more generally for child abuse and neglect. Yeah.
That seems highly important. And so I understand then that maybe a first step is to just help people, and more importantly, children, become aware that, okay, some things are okay and some things are not normal. Maybe some ways of being touched or spoken to that is abusive, and that is not okay. But then I guess there's a big step then to making them feel safe enough to start opening up about it. What do you see would be necessary to help children feel safe to do that?
Yeah, I certainly, having children be aware of what's right and wrong and giving them the tools they need to feel comfortable coming forward is an important piece. I would say even a more important piece is making sure that the adults in their lives are aware and create the environment that encourages those kinds of disclosures. After all, they are children, and it is the responsibility of adults, whether it's their own parents, their relatives, school officials, doctors. It is the community of adults' responsibility to protect children from sexual abuse. So it's not only alerting children, of course, that's an important step, but I would say it's even more important for the adults to have it be in their awareness, to make decisions related to the children that enhance safety and reduce risk. So it's really looking at institutions like schools or sporting organizations, and all the different places where children interact and live. Having those different places really focus on this as an issue is incredibly important.
Mm. when I think back 145 years ago, I think of the biggest issues as maybe children being hit and forced to work. But you're also mentioning that you want to prevent neglect. What, from your point of view, are the common forms of neglect that you're trying to protect children from?
Well, there's emotional neglect and physical neglect that children can experience, where their medical needs aren't being taken care of, they're not being fed, they're not being supervised in the ways that they need to be, being left alone or being out on the streets. So much of that is impacted, of course, by poverty. And so that's a challenge that we have in the child welfare field, to differentiate between families who just need support and resources so that they can meet the needs of their children versus families who are, actually, I'm stopping myself from saying, I think most cases of neglect are related to caregivers who need help with greater resources, whether it's because of their own mental health needs, because of living in poverty, because of substance use addiction. So I think all of these issues require a very comprehensive assessment and intervention to assist the family. We've in the field that, there's been ebbs and flows in terms of what the focus has been. Do we remove children and try to get them into, more stable homes and separate them from the parents? And then that's shifted where we're really focusing on keeping families together, which of course it should be the first choice because children and families should be together, children and parents, and giving them the resources they need to properly take care of their children. Sometimes that can be done, and sometimes the obstacles are just so great that it's safer for the child to be removed or to be placed with a different family.
I can imagine the perspectives of what is helpful is really developing over this long time span. So with all the knowledge you have then, if you could teach the whole country something that you wish for them to know about how to meet the needs of children and avoid this abuse, is there something you would like to teach?
It requires, what I would teach, I suppose, is that it requires everyone's attention and effort. We've all heard of the saying, it takes a village, but it really does require many individuals to provide avenues of support for the children and the families as well. So what I would hope for is that more people, whether you have children or you don't, or they're grown or they're school age, that for more people to become involved in issues of preventing child abuse and neglect, and having, as a society, valuing the safety of children, recognizing all it's a topic that people still don't feel comfortable talking about. Despite the progress we've made, even within the last 5 years, for example, with the Me Too movement, which for those of us who've been working in the sexual abuse and assault field, that was really an amazing time when this issue was finally getting the attention that it so badly needs, as especially because child sexual abuse is an epidemic. So I sort of lost track of where I was going with that, but basically, just people needing to be willing to look at the issue. It's uncomfortable. It's unpleasant. Nobody likes to think of children being raped and molested by relatives or by people you know and trust. That's part of the problem, that the primary perpetrators of child sexual abuse are people known and trusted by the family, which makes it a very hard topic to swallow, to be open to learning about. And so that would be one thing that I would hope members of society would be more willing to grapple with.
Yeah, that's unimaginably hard to deal with. Is there, from your point of view, something that is important then for people to keep in mind when it comes to these cases? Like, what tools can they have to even begin dealing with something so emotionally heavy?
I mean, it starts with just openness to learning about it. There's lots of, online resources that provide, statistics and facts about it. But some of the basic things, basic facts, such as the one I just shared, that most of the time sexual abuse is perpetrated by people we know and trust. Once we can really accept that, then that can lead us to take more precautions in the way that we, take more precautions with our children in the situations they're placed in, and really start those conversations with our children very early on to help them understand, as we were speaking about earlier, what's okay, not okay, what to do. If they find themselves in those situations, who to go to.
Got it. So the vision you have for the New York Society is to have a world free from cruelty and abuse and neglect of children. And tell me a little bit about how you will be a part of that vision. What would you like to accomplish in the next 10 years?
Well, similarly to what we've been discussing, sort of continuing to raise public awareness, to provide trainings, to support others, to recognizing signs and symptoms and what to do about it. We also have to overcome the attitude that, if it's not my family, I shouldn't be involved, or, lots of people have concerns about causing trouble for families if they have some suspicions about what's happening in the home and they don't want to get involved. So we really have to overcome that as well, and help people, in different segments of society take responsibility for protecting kids. I think, in the next 10 years, we really also have to look at the issue of racial justice in child welfare, and address the disproportionality and of children of color in the systems, and all the different societal factors that contribute to that, in terms of poverty and unequal access to education, housing. So it's obviously a very complicated, complex issue, but one that I believe in the next 10 years, the field really the field of child welfare, as in many segments in society, have to really grapple with doing better than we have.
Let's hope we are moving in that direction. And Amy, we're coming towards the end of this interview now, but I really want to ask you, for someone that is listening and feel that they want to be a part of the solution here and do something to help prevent the neglect of children and the abuse of children, what action steps can they do to be part of the solution?
Again, educating themselves on the issues. I think demanding more of the institutions we interact with. So if you're parents, asking the after-school programs, your schools, your summer camps, even your doctor's offices, what do they do to ensure children's safety? I think we can vote for leaders who are invested in children and health, families' health. For our particular organization, there's lots of ways to help in terms of, donating, joining our board, going to our website and looking at the work that we're doing and finding a way to connect us with others doing similar work, collaborating to try to address these problems.
Beautiful. Amy, thank you so much for taking the time to speak with us today. I very much appreciate it, and I learned a lot.
Thank you. It was my pleasure.
Thank you. And for you listening, if you enjoyed this conversation, press subscribe on YouTube or in your podcast app, because that is showing the algorithms that this is an important conversation, so more people can get the opportunity to learn what we can do to prevent the abuse and neglect of children. Thank you so much for listening, and we'll see you in the next episode. What is great.com? That is the most common question that we get. And the shortest answer I can give you is that we are a company that is moving money from the online casino industry and donates it to charities that is helping the environment. The long answer, unfortunately, I don't have time to tell you today. But if you're curious, definitely Google what is great.com to learn more.